Okay, let's talk about Toradol. Toradol. Also, ketorolac. What is Toradol, ketorolac? It is an NSAID. It is a non-steroidal anti-inflammatory drug. NSAID. What is its mechanism of action? It is anti-inflammatory, as set up in the name. Antipyretic. Through inhibition of prostaglandins. Okay, anti-inflammatory, antipyretic. Through it has some analgesic effects or pain relief effects. Through the anti-inflammatory and the antipyretic qualities to it. Why are we going to give these? Well, why would we give an anti-inflammatory or an analgesic? Mild to moderate pain, swelling, and fever. Pretty simple, pretty self-explanatory, and renal colic. Okay, so now what you're going to see in the emergency room is Toradol is given quite a bit, especially for orthopedics and kidney stones. The anti-inflammatory, this is pretty powerful anti-inflammatory. It's essentially a super-powered or a high-powered ibuprofen. So we're going to give it mild to moderate. Well, now that's kind of a misnomer because we're going to give this to, like I said, to our kidney stone patients as well. And through its analgesic and anti-inflammatory actions, it is going to reduce the swelling caused by the stone and also reduce pain. You'll notice that a lot of times the Toradol will actually do more for the pain than a narcotic or a higher powered pain medicine. Our dosing for ketorolac or Toradol is 15 to 30 milligrams in the elderly and 60 milligrams to pretty much everybody else. Adults. Kids you'll probably see in the elderly. Let's go ahead and just add that. 60 milligram to adults. Normal adults. Some of the contraindications, of course, are going to be allergy. If you are allergic to or cannot take ibuprofen, you are allergic to and cannot take Toradol. So, hypersensitivity or allergy, bronchospasms, so you want to be careful with asthmatics or COPDers, bronchitis, that kind of thing. anything where you're going to be at risk for bronchospasm and angioedema. Facial or mouth oral swelling. Adverse reactions. Nausea, vomiting, GI bleed, and allergic reaction. Of course, with allergic reaction being thrown in there as a adverse reaction or a side effect, that kind of goes with the angioedema. It's going to cause those kinds of things. The routes for ketorolac are IV and IM. I have seen some pills, but you're not going to see that in the ER or pre-hospital setting unless it's a prescription. It does have the ability to cause dizziness, as well as headache. Drug interactions, of course, like I said, you do not want to give additional ibuprofen. Other than that, I believe it's pretty benign with other medications.